Hi everyone, welcome to the Facial Anatomy Project. In this course, you are going to learn how to shape facial muscles from clay and apply them to a human skull. What you will learn in this video are some of the same processes used by forensic artists when creating 3D facial reconstructions. So let's take all the supplies out of the box and make sure we have a complete kit. The complete kit contains a resin skull mounted on an armature. The armature is the base, the steel pipe, the metal ring, the framework on which the skull sits. And you'll see that the skull is missing a skull cap. And here's the skull cap. Also in the box is a pound of oil-based clay, a wooden skewer, a wooden sculpting tool, and 2 cotton balls. What is not in the box, but you will need, is a ruler with metric measurements, millimeters and centimeters. The ruler will be used for measuring muscle length and thickness. Let's go ahead and attach the skull cap to the top of the skull. It only fits one way. Now that the skull is completely assembled, we can start adding the muscles. This is the list of muscles that we are going to apply to the skull, and we are going to apply them in this order. There are 17 muscles and 1 gland. Orbicularis oris, temporalis, Buccinator, Masseter, Orbicularis oculi, Levator anguli oris, Levator Labii, Mentalis, Depressor Labii, Depressor anguli oris, Frontalis, Procerus, Compressor naris, Labii alaeque nasi, Zygomaticus major, Zygomaticus minor, Risorius, and the parotid gland. As we attach the muscles, you will need to understand left and right orientation of the skull. So when you are looking at the skull, this is the left side of the skull. It's not your left side, but the left side of the skull. And this is the right side of the skull. Again, not your right side, the right side of the skull. You will apply muscles to both the right side and the left side of the skull, but in this video, we will always start by applying muscles to the right side of the skull. So let's begin. The first muscle we will attach is the Orbicularis oris. This is an unpaired muscle, and by that I mean there is only one of this muscle, and is located in the center of the skull. A paired muscle would mean there's a muscle on the left side of the skull, and the same muscle on the right side of the skull. But there is only one Orbicularis oris muscle in the center of the skull. It is an unpaired muscle. This muscle encircles the mouth. It attaches to the bone just above the teeth in the upper jaw and just below the teeth in the lower jaw. Your upper jaw is called your maxilla, and your lower jaw is called your mandible. You are going to want to remember these words because we will use them again when attaching other muscles. The function of the Orbicularis oris muscle is that it allows you to pucker and blow, like when you were blowing out a candle. So to create this muscle, we're going to roll out a thin slab of clay 2 millimeters thick. You'll need to really work the clay. Roll it around in your hands for a few minutes until it becomes soft, because the clay is quite stiff and hard in the beginning. So once it's soft enough, press it onto the table, and then we're going to measure 2 millimeters thick, and this is where your ruler comes in handy. Now we're going to use our wooden sculpting tool, and we're going to cut out an oval shape, 5 centimeters by 4 centimeters. The 5 centimeters is going to be the measurement from left to right, the width of the oval, and the 4 centimeters is going to be the measurement from the top to the bottom of the oval. So remember, cut out an oval shape, 5 centimeters by 4 centimeters. Now we're going to make it into an oval shape. It's not going to look like an oval after you cut it, so we have to work it with our hands a little bit, forming this oval shape. Now we're going to apply the muscle to the skull. On the maxilla, the upper jaw, the muscle should cover the left and right canine teeth. And the canines are easily found because they are the third tooth from the center line, located just below the nose. There's your center line, And there's your first, second, and third tooth. And that's your canine. On the mandible, the bottom jaw, the muscle is going to cover the left and right fourth tooth from the center line. And this tooth is called your first premolar. 1, 2, 3, 4. And here you can see that the maxillary canine articulates or touches or meets the mandibular first premolar. So now we are going to lightly press the clay onto the skull so that the muscle adheres to or sticks to the skull and does not fall off. Remember, the muscle is attached to the bone just above the teeth in the maxilla and just below the teeth in the mandible. Now we are going to use our wooden skewer and draw in muscle striations in a circular manner. Why are we creating muscle striations? Muscle tissue is classified into 3 types: cardiac muscle, smooth muscle, and striated or skeletal muscle. Cardiac muscle is found in your heart. Smooth muscle is found in your internal organs, for example, your stomach, your intestines, your blood vessels. And striated muscle, or skeletal muscle, are muscles that attach to your skeleton, your bones, and allow you to perform a wide range of movements, like walking, rowing a boat, practicing yoga, and even chewing. These muscles that we are attaching today are all involved with the movements of facial expression, and they're all striated or skeletal muscles. And what do the striations tell us? Why are they important? They tell us the direction of pull or contraction of the muscle. The Orbicularis oris muscle is pulling your lips towards the center line to create a pucker motion or a whistle motion or being able to blow out a candle motion. So let's keep drawing in the striations in a circular manner. And you can see that we draw many, many striations on the clay. And we are using our wooden skewer to draw in these striations. And here we go. There is your Orbicularis oris muscle. So now the first muscle is attached to the skull. The second muscle that we are going to attach to the skull is the temporalis muscle. This is a paired muscle. There is a right temporalis muscle and a left temporalis muscle. The temporalis muscle is a fan-shaped muscle. It follows the temporal line on the side of the skull. This green arrow shows us the temporal line on the side of the skull. And it passes under the zygomatic arch. This is your zygomatic arch. And it attaches to the coronoid process of the mandible, which we can't see, but it is attached to the skull at this point. The temporalis muscle works with the masseter muscle by pulling up the lower jaw, the mandible, for instance, when chewing. It also pulls up the mandible when your teeth are clenched. So to create the temporalis muscle, we're going to roll out 2 coils of clay. Each coil of clay is approximately 1 centimeter in diameter and 7 centimeters in length. Now, using your fingers, we're going to attach the coils of the clay to the right side of the skull in a fan shape. So we're going to adhere or attach or make the clay stick to the skull, these 2 coils of clay. And if the coils slightly go past the temporal line, don't worry, you can cut off the clay. So now we're going to blend, squish, flatten the coils with your fingers to make the fan-shaped muscle. Remember, the muscle cannot go beyond the temporal line, and it will pass under the zygomatic arch. So let's blend, let's squish, let's flatten the clay. Anteriorly, the clay should not go beyond the eye orbit ridge. And that's the ridge there on the right side where my fingers are. You can see that the clay only goes up into that ridge, the eye orbit ridge. So let's keep blending the clay. This is a very thin muscle. So this will be an adequate amount of clay. You may think that you don't have enough clay, but trust me, you do, because it is quite a thin muscle. And there's your fan-shaped muscle. There we go. Anteriorly, it doesn't pass the eye orbit ridge. And remember, the muscle follows the temporal line, and it doesn't pass downwards, it doesn't pass the zygomatic arch. And there is your anterior positioning of your eye orbit of the muscle. So now the wooden skewer is going to be used to mark the fan-shaped striations in an up and down motion. So we're going to follow the shape of the clay, of the muscle, for these striations. It's going to be fan-shaped striations. You can see as we're working here with the wooden skewer how the striations should look and in what direction they should be placed. Fan-shaped striations for a fan-shaped muscle. And if there are little tiny balls of clay, you can wipe them away a little bit. They can fall off, that's fine. And there's the fan-shaped striations. The muscle is going to contract in this manner, up and down. Now, using these instructions, you can go ahead and attach the temporalis muscle on the left side of the skull. The third muscle we will attach to the skull is the Buccinator muscle. The Buccinator muscle is a flat muscle. It's a paired muscle, meaning there's a left Buccinator muscle and a right Buccinator muscle. And this muscle sits directly on the inside of the cheek next to the teeth. The Buccinator muscle runs horizontal and blends into the corner of the Orbicularis oris. The function of the Buccinator muscle is that it controls airflow through the mouth so that you can whistle, suck in and blow out air, essential for meditative breathing and playing some musical instruments, for example, the trumpet. Another cool function of the Buccinator muscle is that it assists with chewing. It helps move around the food inside your mouth. But have you ever bitten the inside of your cheek when chewing? Well, this happened because the Buccinator muscle did not move out of the way before your teeth clamped down and started to chop up the food. So we're going to roll out a slab of clay 2 millimeters thick. Now we're going to use the wooden sculpting tool and we're going to cut a slab of clay to a rectangle, 3 centimeters by 2.5 centimeters. The 3 centimeter measurement will be the measurement from left to right, or the width of the muscle. And the 2.5 centimeter measurement will be the measurement from the top to the bottom of the muscle, of the rectangle. So the rectangle is 3 centimeters by 2.5 centimeters. Now we're going to place the muscle on the right side of the skull so that it covers all the teeth and blends into the corner of the Orbicularis oris muscle. The muscle is just covering the teeth, as you can see in this video. And again, blending into the corner of the Orbicularis oris muscle. Now use your wooden skewer and draw in muscle striations. These striations are going to run horizontally, left to right. And this is going to indicate the direction of the muscle contraction or pulling of the muscle. So here we go, drawing in the muscle striations horizontally or left to right. And you can see that the muscle just covers the teeth, both in the maxilla and in the mandible. Now, using these instructions, you can go ahead and attach the Buccinator muscle on the left side of the skull. The The fourth muscle that we will attach is the masseter muscle. The masseter muscle is a flat muscle that runs diagonally from the gonial angle of the mandible to the inferior portion of the zygomatic bone of the skull, like seen here in the video. It is a paired muscle, meaning there's a left masseter muscle and a right masseter muscle. The function of the masseter muscle is that it moves the mandible during yawning and chewing. So roll out a slab of clay 3 millimeters thick. Now, using your wooden sculpting tool, cut the slab into a rectangle. The rectangle is going to measure 7.5 centimeters by 3 centimeters. 7.5 centimeters is going to be the width or the measurement from left to right, and 3 centimeters is going to be the measurement from the top to the bottom of this rectangle. So cut out a slab of clay into a rectangle, 7.5 centimeters, measuring left to right, and 3 centimeters from top to bottom. Now place the muscle on the skull like this. You're going to want to tuck the muscle under the gonial angle of the mandible. Tuck it under the mandible so that it will attach the skull nicely. And then press the top portion of the muscle, press it into the zygomatic arch, into the skull, so that it sets like this. Now, using your wooden skewer, we're going to draw on striations. Striations are applied in a vertical manner, up and down, because the motion of the contraction is up and down. And here we are applying the striations up and down, because that is the motion of the muscle, up and down. And again, if there's little balls of clay that start to appear as you're drawing in the striations, you can just clean them off. Now you can attach the masseter muscle on the left side of the skull. The fifth muscle that we are going to attach is the Orbicularis oculi muscle. This is a paired muscle, meaning there's a left orbicularis oculi and a right orbicularis oculi. It is a wide, flat muscle that encircles the eye and is located in the eyelid. The main function of the Orbicularis oculi is to close the eyelids. The first thing we are going to do is we're going to make an eyeball. So roll out a ball of clay that is 2 centimeters in diameter. Now take one cotton ball and place it inside the right eye orbit. The orbit is the socket, or the hole in the skull where the eyeball sits. Take the eyeball and place it inside the socket, gently pushing on the cotton ball. The eyeball needs to project or to stick out slightly from the eye socket, and you'll see why in a minute when we attach the Orbicularis oculi muscle. Once you've confirmed that the eyeball is the correct size, place it on the table next to you. Now we are going to roll out a coil of clay that is 1 centimeter wide and 14 centimeters long. Again, the clay might be a little bit hard, so we have to roll it out in our hands. And the coil is going to be 1 centimeter wide and 14 centimeters long. If it's a little bit too long, just take the wooden sculpting tool and cut off a little bit at the end. Then we're going to flatten the coil just slightly. So just take the ends of your fingers, your fingertips, and just slightly press down on the coil. Not flatten it completely, just flatten it slightly. Next, we will place the coil on the eye orbit. So we're going to wrap that coil around the eye orbit, around that socket where the eyeball is placed. Now take your eyeball and place it inside the Orbicularis oculi muscle and press the muscle around the eyeball. The muscle is just going to hug the eyeball. The muscle just holds the eyeball in place so it does not fall out of the eye socket. So wrap it around. If it's a little bit too long, you can take your wooden sculpting tool and cut off a little piece of that coil, but just wrap that coil around the eyeball and gently press that coil into the skull. So the coil should be hugging the eyeball and should be sticking to the skull. Now, using your wooden skewer, we're going to draw on the muscle striations. And the muscle striations run in a circular pattern around the eyeball, as shown here in the video. So draw muscle striations in a circular pattern on the orbicularis oculi muscle. Not on the eyeball, just on the orbicularis oculi muscle. Draw in all of those circular striations. Lastly, we are going to create a hole in the middle of the eyeball. So take a pencil and place it in the center of the eyeball. And just twist it. Twist the pencil slightly to create a hole. Don't push the pencil all the way in, just slightly to create a hole in the center of the eyeball. And this gives the eyeball a more realistic appearance. So now you can follow these directions and apply the orbicularis oculi on the left side of the skull. The sixth muscle that we are going to attach to the skull is the levator anguli oris muscle. Now, by looking at this slide, you may think it's kind of confusing. Where exactly is this muscle? The levator anguli oris muscle is actually underneath a bunch of other muscles. So we're going to attach the levator anguli oris muscle now, and then later on, we're actually going to attach two other muscles on top of it. So this photograph, this picture is actually showing you what the final version, the final product of your facial anatomy project will look like, and you won't actually see the levator anguli oris muscle because it's going to be underneath other muscles. But this is showing you the shape of the levator anguli oris muscle and where exactly it attaches. So the levator anguli oris muscle is a paired muscle, meaning there's a left levator anguli oris muscle and a right levator anguli oris muscle. The levator anguli oris muscle arises from the zygomatic bone, or your cheekbone. This is your zygomatic bone, and it inserts into the corner of the orbicularis oris, the corner of the mouth, the top portion of the orbicularis oris. The levator anguli oris muscle helps the face form one of the most universally known expressions, the smile. This muscle lifts the corner of the mouth and is used when smiling or laughing. Roll out a thin slab of clay 1 millimeter thick. Now we're going to use our wooden sculpting tool, and we're going to cut this clay into a triangle, 4 centimeters by 4 centimeters by 2 centimeters. The two vertical sides, the sides on the left and the right side of the triangle, are 4 centimeters long each. And the one horizontal base, that base at the bottom that runs left to right, that is going to be 2 centimeters long. So 4 centimeters by 4 centimeters by 2 centimeters, as shown here in the video. So again, the two vertical sides are 4 centimeters long, and the horizontal base is 2 centimeters long. And then there's a pink asterisk at the top point of the triangle. Keep that in mind because this is going to be used. I'm going to refer back to this asterisk when we are attaching the muscle to the skull. So now we're going to attach the short side, the 2 centimeter side, the base of the triangle, to the inferior portion of the zygomatic bone. This is the inferior portion of the zygomatic bone, the lower portion of the zygomatic bone. So that's where the 2 centimeter base is going to attach to the inferior portion of the zygomatic bone. And then we're going to attach that top point, that point where that pink asterisk was. We're going to attach that top point of the triangle to the top corner of the orbicularis oris muscle, as shown here. So here's the 2 centimeter side base attaching to the zygomatic bone, and then that point of the triangle where the asterisk was, that's now attaching to the top corner of the orbicularis oris muscle. Now gently just push this muscle, press gently into the skull so that it attaches or sticks to the skull, and then that point, just gently press that into the orbicularis oris muscle. Now, using your wooden skewer, we're going to draw in the muscle striations. The muscle striations run vertically, up and down, because that is the motion, that is the contraction of this muscle. Again, it's to form the facial expression of smiling, so it's going to lift the lips, lift the corner of the mouth, used when smiling or laughing. So now, using these instructions, you can now go ahead and attach the levator anguli oris muscle to the left side of the skull. The 7th muscle that we are going to attach is the levator labii muscle. Now again, this illustration may look kind of confusing because there's more than one muscle illustrated, and that is because the levator labii muscle is actually covered up by another muscle. So this illustration is showing you what the final product, what your final facial anatomy project will look like. And the green is highlighting the shape of the levator labii muscle, where it attaches. So this helps you see it in the final product, but it actually will be covered up partially by another muscle. The levator labii muscle is a paired muscle, meaning there is a left levator labii muscle and a right levator labii muscle. The levator labii muscle attaches to the orbicularis oculi muscle and is blended into the orbicularis oris muscle. The levator labii muscle elevates or pulls up the upper lip to expose the maxillary teeth to produce the facial expression of smiling. To create this muscle, we're going to roll out a slab of clay 1 millimeter thick. And we're going to cut it into a rectangle, 3.5 centimeters by 2 centimeters. So we're going to cut out a rectangle, 3.5 centimeters. The 2 vertical sides that run up and down are going to be 3.5 centimeters. And the sides that are going to run left to right, the top and the bottom sides that run left to right, are going to be 2 centimeters in length. That small piece there is going to be our levator labii muscle. This side is going to run 3.5 centimeters and the bottom side is going to run 2 centimeters. Now we're going to take that rectangle, we're going to attach the 2 centimeter length, the shorter length. We're going to attach it to the inferior, the bottom portion, the inferior portion of the orbicularis oculi at the midpoint. So there's the 2 centimeter side attaching to the midpoint of the orbicularis oculi. And next we're going to attach the other 2 centimeter length to the superior lateral portion of the orbicularis oris. So superior meaning the top, the lateral meaning a little bit further lateral from the midpoint. And now we're going to use the wooden skewer and we're going to create the muscle striations, which run vertically. They run up and down because that is the function, the contraction, the pulling motion of this muscle. So now that we've created the levator labii muscle on the right side of the skull, we can follow these directions and create the muscle on the left side of the skull. The 8th muscle that we are going to attach to the skull is the mentalis muscle. This is a cone-shaped muscle, a triangle-shaped muscle, and it is a paired muscle, meaning there is a left mentalis muscle and a right mentalis muscle. The muscle is found on the mid-mandible, on either side of the central ridge of bone. And this point, this projection, this ridge of bone on the lower part of the chin, on the mandible, is called the mental protuberance or the mental eminence. The muscle also attaches to the inferior portion or the lower portion of the mandible. The mentalis muscle helps to form the facial expression of doubt and contempt. The muscles raise the skin of the chin and elevate the lip, everting or turning outward and protruding the lower lip, like a pout. Hence why the mentalis muscle is nicknamed the pouting muscle. Another interesting fact about the mentalis muscle, if you have a dimple on your chin, it may be the result of a space between the left and the right mentalis muscle. So now we're going to roll out a slab of clay 1 millimeter thick. And we're going to cut out a triangle. The triangle is going to measure 2 centimeters by 2 centimeters by 1.5 centimeters. The 2 vertical sides, the sides that run up and down, are going to measure 2 centimeters in length. And the one horizontal base, the base that runs left to right, is going to measure 1.5 centimeters long. So using your wooden cutting tool, your wooden sculpting tool, cut out the 2 vertical sides, 2 centimeters by 2 centimeters, and then the horizontal base, 1.5 centimeters long, like shown in the video. And here's the final product. Take note of where the pink asterisk is on that point, because that's going to help us orientate the muscle onto the skull. So now we're going to apply the muscle. Place the 1.5 centimeter side, the base, the shortest side, on the inferior portion of the mandible. And place the longer sides, the 2 centimeter side, so that one of them is touching that medial mandibular ridge. The top point, where the pink asterisk was, this will just touch the orbicularis oris. Now, using your wooden skewer, we're going to draw in muscle striations, and these are going to run vertically up and down. Now, using these instructions, attach the mentalis muscle on the left side of the skull. The next 2 muscles that we're going to attach are muscle number 9 and muscle number 10. Muscle number 9 is the Depressor Labii muscle, and muscle number 10 is the Depressor anguli oris muscle. Both muscles are paired muscles, meaning there is a left Depressor Labii muscle and a right Depressor Labii muscle. There is a left Depressor anguli oris muscle and a right Depressor anguli oris muscle. Both muscles attach to the inferior portion of the mandible and insert into the lower lips. But since we're not constructing lips, these muscles will attach to the orbicularis oris muscle. The Depressor Labii muscle and the Depressor anguli oris muscle function to pull down the corners of the mouth and the lower lip to assist with the facial expression of frowning. To create the muscle, we're going to press out a slab of clay 1 millimeter thick, and then cut out a square 2 centimeters by 2 centimeters. So we've made one of the 2 centimeter cuts. And now we're going to measure for the second 2 centimeter cut. So now you should have a square that's 2 centimeters by 2 centimeters. And you might have to play with the clay a little bit, form it so that it is into an actual square. Now we're going to place a diagonal cut in the middle of the square to create 2 triangles. One of the triangles will become your depressor labii muscle, and the other triangle will become your depressor anguli oris muscle. To attach the depressor labii muscle, we're going to flip the triangle upside down, as shown here in the picture, in the green highlighted muscle, so that the base of the triangle will attach to the orbicularis oris muscle, and the top point of the triangle will actually tuck under the mandible. Part of the depressor labii muscle will also sit next to the mentalis muscle. So let's go ahead and attach the muscle. The short base of the triangle will attach to the orbicularis oris muscle, and then the top point of the triangle will tuck under the mandible. So basically you've attached an upside down triangle, and it's going to sit right next to and almost on top of the mentalis muscle. So the next muscle we're going to attach is the depressor anguli oris muscle, and that's your other triangle, the second triangle you created from that square. And it's going to attach like shown here in the blue. And it's basically going to attach like a right side up triangle. So the base of this triangle will tuck under the mandible, and the top point will touch the orbicularis oris muscle. So now you've attached an upright or right side up triangle. And again, a side of the depressor anguli oris muscle will sit next to the depressor labii muscle. So these three muscles, your mentalis muscle, your depressor labii muscle, and your depressor anguli oris muscle, all sit right next to each other. So now, using your wooden skewer, we're going to draw on the striations, which run vertically up and down. So now, using these instructions, you can attach the left depressor labii muscle and the left depressor anguli oris muscle to the skull. The 11th muscle that we are going to attach is the frontalis muscle. It is a paired, flat sheet of muscle that is located in the forehead. The function of the frontalis muscle is to raise the eyebrows, and it is the only muscle that raises the eyebrows. It plays a significant role in our day-to-day social interactions by conveying emotions through nonverbal communication. Through elevation of the eyebrows, or raising the eyebrows, the frontalis muscle creates distinctive forehead wrinkles, giving rise to the expressions of surprise, concern, curiosity, or when someone is trying to focus intently on something, you'll see their forehead wrinkle. Bilateral simultaneous contraction of the frontalis muscle, meaning when both the right and left sides of the muscles pull or contract at the same time. So bilateral simultaneous contraction of the frontalis muscle raises the entire forehead, causing the eyebrows to move upwards. This action is associated with the expression of surprise, excitement, curiosity. Unilateral contraction of the frontalis muscle, meaning when only one of the right or left sides of the muscle pull or contract, not at the same time. So unilateral contraction of the frontalis muscle causes a slight raising of the eyebrow on only one side. This can convey subtle expressions of doubt or skepticism. So to create this muscle, we're going to roll out a very thin slab of clay, approximately 1 millimeter thick. Then we're going to use the wooden sculpting tool and cut out a rectangle, 6 centimeters by 4 centimeters. 6 centimeters, so we'll cut at the 6 centimeter mark. And now we're going to cut at the 4 centimeter mark. So your rectangle will be 6 centimeters by 4 centimeters. Now, inferiorly, the lower part of the frontalis muscle. The lower part of the frontalis muscle is going to blend with the orbicularis oculi. Remember where your orbicularis oculi was? That was the muscle that surrounded the eyeball, remember? Superiorly, or the top part of the frontalis muscle, is going to continue along the frontal bone until it almost touches the coronal suture. And this is your coronal suture. So let's attach the muscle. So the shorter side of this muscle, the 4 centimeter side, should be touching your orbicularis oculi, and the other short end will touch the corneal suture. And the muscle is quite thin, so you're just going to need to work the muscle with your fingers. You're going to need to press it along so that it fits into this spot, blend it in so that you now have the frontalis muscle attached. So now we're going to take the wooden skewer and we're going to add muscle striations. And these muscle striations run vertically, up and down, but up and over the forehead. So they're going to run all the way to the top of the muscle, because that is the motion of contraction of the frontalis muscle. It contracts up and down in order to raise the eyebrows, raise the forehead skin. And there you have the frontalis muscle. So using these instructions, you can go ahead and attach the frontalis muscle on the left side of the skull. The next muscle that we are going to attach is the Procerus muscle. It's a small, unpaired muscle that lies in the center of your forehead between your eyebrows. And here is where the Procerus muscle lies, in the center of your forehead between your eyebrows. The function of the Procerus muscle is that it pulls the medial ends of your eyebrows downward and helps flare your nostrils. The medial ends of your eyebrows are the ends closest to your nose, the ends closer to your midline, or the middle of your face. This creates the facial expression of frowning to convey emotions of anger or sorrow. Or when you are exposed to bright sunlight or other eye irritants, you may squint and see wrinkling of the skin between the eyebrows. So to create this muscle, we're going to roll out a thin slab of clay 1 millimeter thick. Then we're going to cut out a rectangle, 7 centimeters by 1.5 centimeters. So here we are cutting out at the 7 centimeter mark. And now we are going to cut at the 1.5 centimeter mark. So you're going to have a narrow, long piece of clay for the Procerus muscle. It's going to be a longer piece of clay, but quite narrow in width. Width being the left to right measurement. It's only 1.5 centimeters left to right. Procerus is located on the medial side of the frontalis muscle. Medial meaning closer to the midline or the middle of your face. So this is where Procerus is located. Remember, Procerus is an unpaired muscle. There's only one Procerus muscle. The Procerus muscle is continuous with the frontalis muscle, meaning that it's hard to distinguish the two muscles from one another. The inferior margin of the Procerus muscle, or the bottom portion of the muscle, will extend slightly past the superior margin of the nasal bones. And these are your nasal bones right here. So these are your nasal bones. And the superior margin, this is the superior margin of your nasal bones. So the inferior part of Procerus, or the bottom part of the lower portion of Procerus, is going to extend past the superior margin of your nasal bones. So Procerus is going to extend approximately just at the level of the mid-eyeball. So just around the level of the mid-eyeball is where the Procerus is going to extend to. If it extends too far, don't worry about it. It'll be covered by the next muscle, which will attach to the bridge of the nose. Superiorly, the top portion of the Procerus muscle continues along the frontal bone until it meets the superior or the top portion of the frontal bone. And this picture here shows you Procerus actually already attached to the frontalis, and you can see that they're almost indistinguishable. So now we are going to attach the Procerus muscle. So superiorly, it's going to extend superiorly to the same level as the frontalis muscle. And then inferiorly, the bottom portion of Procerus is going to extend into those nasal bones, extend approximately to the mid-eyeball area or region. And Procerus is very, very thin, so keep pressing and pushing that clay. You've got more than enough clay there to make this Procerus muscle. It may seem like you don't, but trust me, you do. It's a very, very, very thin muscle. And again, remember, it's unpaired. There's only one Procerus muscle. So now we're going to add the muscle striations. And the muscle striations run vertically, up and over the forehead. So using your wooden skewer, let's add in the muscle striations. They run up and over the forehead. Similar direction as the muscle striations on the frontalis muscle. And there you go, you've created Procerus. The next muscle that we are going to attach is muscle number 13, the compressor naris muscle. The compressor naris muscle is a paired muscle, and it forms one of the nasalis muscles, or nose muscles. The nasalis muscles are comprised of two muscles, the compressor naris and the dilator naris. We are only going to attach the compressor naris muscle. The function of the compressor naris muscle is to constrict, to compress, to close the nostrils. For example, it is used during deep breathing. When you breathe in, your nostrils flare, and when you breathe out, your nostrils compress. When you breathe out, that is when you are using your compressor naris muscles. The compressor naris attaches on the maxilla, just superior to the canine tooth, or just above the canine tooth. Remember we talked about the canine tooth previously? It's the third tooth from the midline of your maxilla. So the compressor naris attaches on the maxilla and passes over the dorsum of the nose. And this is the dorsum of your nose. The dorsum of the nose is the bridge of the nose. We are going to attach other muscles alongside the nasal aperture. The nasal aperture is the nose opening. So we are going to attach other muscles alongside the nasal aperture. And because we cannot make the compressor naris muscle thin enough to mimic in life, we are only going to attach part of the compressor naris muscle, the part that covers the bridge of the nose. And this is also the method used by forensic artists when creating 3D facial reconstructions. So to create this muscle, we need to roll out a slab of clay 2 millimeters thick. And then we're going to use our wooden sculpting tool, and we're going to cut out a rectangle, 2.5 centimeters by 1 centimeter. It's a very, very tiny rectangle, 2.5 centimeters by 1 centimeter. So here's the 2.5 centimeter marking in the cut, and here's the 1 centimeter cut. So you can see it's a very small rectangle. We're going to attach this muscle on the bridge of the nose. Like so. Just slightly tap it on, press it slightly so that it sticks or adheres to the skull. By doing this, we have actually attached the right side of compressor naris and the left side of the compressor naris muscle. So now using your wooden skewer, draw in the muscle striations that run horizontally or left to right. And there, you have completed the compressor naris muscle. Muscle number 14 is the Labii alaeque nasi muscle. This is a paired muscle, meaning there's a left Labii alaeque nasi muscle and a right Labii alaeque nasi muscle. It is a small, rectangular shaped muscle that splits into two parts. It looks like a pair of pants with one short leg and one long leg. The short leg will attach to the nostrils, but since we're not creating nostrils, the short leg will attach to the nasal aperture, as shown here. The long leg is going to attach to the Orbicularis oris. The function of the Labii alaeque nasi muscle is that it dilates the nostril and raises the upper lip, enabling you to snarl. Elvis Presley is famous for using this muscle, and it is sometimes therefore referred to as the Elvis muscle. To create this muscle, roll out a slab of clay 2 millimeters thick. And then we're going to use our wooden sculpting tool, and we're going to cut out a rectangle, 5 centimeters by 1 centimeter. So here we are measuring and cutting for the 5 centimeter measurement. So 5 centimeters by 1 centimeter. And here we are marking and measuring for the 1 centimeter cut. Orientate the rectangle so that the short side, the 1 centimeter side, is at the top, running horizontally, left to right. And orientate it so that the long side, the 5 centimeter side, is running vertically, up and down. At the midline of the top of the rectangle, measure 1.5 centimeters down from the top. So take your wooden skewer, and at that 1.5 centimeter mark, just put a little hole in the clay. So that's 1.5 centimeters from the top of that rectangle. Now we're going to cut a pair of pants. So we're going to cut the clay into 2 pieces, keeping the top part of the clay together. We're going to use our wooden skewer rather than our wooden cutting tool because the pants are quite small and the skewer's a smaller tool to use. So from that hole that was 1.5 centimeters from the top, cut downward so that the pair of pants are still together at the top. But you've now got 2 legs in your pair of pants. So now we're going to measure 3 centimeters from the top of the pair of pants. On the right-hand side of this pair of legs, these pant legs, the right one, measure 3 centimeters from the top. And then we're going to cut off that right pant leg. So the right pant leg now is going to be shorter than the left pant leg. So now we're going to attach the muscle to the skull. We're going to attach the short side of this muscle, the 1 centimeter side, short side of the muscle. We're going to attach the short side of the muscle just inferior to the corner of the eyeball. And here we are, just inferior, just below the corner of the eyeball. So the short side is going to attach just inferior to the corner of the eyeball. The short leg is going to sit on the lateral side of the nasal aperture. Lateral meaning further away from the midline. And it's going to insert into the alaeque cartilage. The alaeque cartilage forms the walls of your nostrils. The longer leg pant is going to insert into the Orbicularis oris, as shown here. And if it's a little bit too long, that's okay. You can cut off just a little bit at the end of it. So it should look like the following. Now, using your wooden skewer, we're going to create muscle striations. And these striations run vertically, up and down. So now you've created your right labii alaeque nasi muscle. Using these directions, you can go ahead and create the left side of the skull. The next 2 muscles that we are going to attach are muscle number 15 and muscle number 16. Muscle number 15 is the Zygomaticus major, and muscle number 16 is the Zygomaticus minor muscle. The Zygomaticus major and the Zygomaticus minor are both paired muscles, meaning there's a left Zygomaticus major and a right Zygomaticus major. There's a left Zygomaticus minor and a right Zygomaticus minor. These muscles are placed diagonally. So they're going to attach to the zygomatic bone and insert, this is the zygomatic bone right here. So they're going to attach to the zygomatic bone and they're going to insert into the lateral side of the orbicularis oris muscle near the corner of the mouth. The function of the Zygomaticus major is that it lifts the corners of the mouth superiorly, meaning upward, and also lifts the corners of the mouth laterally, meaning outwards or away from the midline. This muscle causes the corners of your mouth to rise when you smile. The function of the Zygomaticus minor is that it elevates or lifts the upper lip and draws it posteriorly, meaning backward. It also draws the upper lip laterally, meaning outward or away from the midline, thus exposing the maxillary teeth. This movement is used to facilitate speech, as well as to enable various facial expressions, such as smiling. So to create the muscle, we're going to roll out a ball of clay. We're going to press the ball of clay into a slab, and the slab is going to be 1 millimeter thick. Now, using the wooden sculpting tool, we're going to cut out a rectangle that's 6 centimeters by 2 centimeters. So here we're making the 6 centimeter cut. And the next we're going to make the 2 centimeter cut. So we're going to have a rectangle that is 6 centimeters by 2 centimeters. 6 centimeters long, so from top to bottom, and 2 centimeters wide from the measurement from left to right. Now we're going to cut the clay into 2 equal pieces down the long length of the rectangle. So if you orientate the rectangle in front of you, the shorter length should be on the top, and the longer lengths should run up and down on the sides. So we're going to cut the clay into 2 equal pieces down the long length of the rectangle. So we're going to orientate the clay so that the short side runs horizontally, is at the top and runs left to right, and the long sides run vertically up and down. We're going to attach the Zygomaticus minor muscle first. So we're going to attach the superior portion of the Zygomaticus minor to the anterior inferior portion of the zygomatic bone. Anterior meaning the front and inferior meaning the lower portion of the bone. The Zygomaticus minor is also going to sit lateral to the Levator Labii muscle, meaning on this side of the Levator Labii muscle, further away from the midline. We're going to attach the inferior portion of Zygomaticus minor to the lateral side of the orbicularis oris muscle. So you can see here that the superior portion of Zygomaticus minor, the top portion, is going to attach to the zygomatic bone, and the inferior portion is going to attach to the orbicularis oris muscle. Make sure that the Zygomaticus minor muscle is in line with the lateral side of the eyeball, the side of the eyeball that's furthest away from the center. Now we're going to attach the Zygomaticus major to the lateral side of the Zygomaticus minor. This is the lateral side of Zygomaticus minor. So Zygomaticus major is going to attach in the same way. Short side is going to attach to the zygomatic bone, and the other short edge is going to attach to the orbicularis oris muscle. You can see that the Zygomaticus minor and the Zygomaticus major, these muscles sit superiorly or on top of the levator anguli oris muscle. And we attached the levator anguli oris muscle. That was muscle number 6 that we attached to the skull. So now we're going to use our wooden skewer and we're going to draw on muscle striations that run vertically up and down. And once we've added the muscle striations, you can now go ahead and use these instructions and attach the left Zygomaticus major and the left Zygomaticus minor to the skull. The last muscle that we are going to attach is the Risorius muscle. We still have one gland to attach, but this is the last muscle that we're going to attach. This is muscle number 17. Risorius is a paired muscle, meaning there's a left Risorius muscle and a right Risorius muscle. The Risorius is a long, thin muscle that sits on top of the Masseter muscle. and inserts into the lateral side of the orbicularis oris. The Risorius muscle pulls the angle of the mouth or the corner of the mouth laterally, giving rise to facial expressions such as grinning, smiling, or laughing. Fun fact, the word Risorius is a Latin word that means laughing. So to create the Risorius muscle, we're going to roll out a thin coil of clay, approximately 3 millimeters to 4 millimeters thin and 6 centimeters long. So it's a very, very, very thin coil of clay, 3 to 4 millimeters wide and 6 centimeters long. Now we're going to slightly flatten the coil with our fingers. So don't press it so that it's completely flat, but just flatten it slightly so that it's not so round. We're going to attach one end of the muscle to the lateral side of the masseter muscle at the midpoint, as shown here. And we're going to connect the other end of the Risorius muscle to the lateral side of orbicularis oris at the corner of the mouth, like shown here in the video. So it's going to attach from midpoint of the masseter muscle to the corner of the mouth or the corner of the orbicularis oris muscle. Now we're going to use our wooden skewer and draw on the muscle striations. And these muscle striations run vertico-horizontally along the muscle. The muscle striations run on a diagonal to the muscle. So vertico-horizontally meaning they run in a diagonal manner. So using your wooden skewer, draw on the muscle striations. So now using these instructions, you can go ahead and attach Risorius to the left side of the skull. The last anatomical structure that we will attach to the skull are the parotid glands. Your parotid glands sit on the posterior corner of the mandible, meaning it sits on the corner near the back of the skull, in like a triangle. Your parotid glands are major salivatory glands. You have a left parotid gland and a right parotid gland. The parotid gland sits on the posterior corner of the mandible, meaning it sits on the corner near the back of your skull. This corner right here. And this corner is also called your gonial angle of the skull. The parotid glands produce saliva, or spit, to keep your mouth lubricated. They assist in chewing, speaking, swallowing, and digestion. When you eat, it's not only your teeth and jaws that help you process your food, but saliva helps to break down the food you eat and move it down the throat. If your salivatory glands are damaged and are not producing enough saliva, it can affect your taste, make chewing and swallowing more difficult, and increase the risk for cavities, tooth loss, and infections in the mouth. So to create this muscle, we're going to roll out 2 coils of clay, approximately 3 millimeters wide and 6 centimeters long. So here we are measuring for the length, and we'll cut the coil off at 6 centimeters. And again, we're measuring for a 6 centimeter length. And then we're going to pinch off very small balls from the coil of clay. The little balls of clay are going to form a triangle at the gonial angle of the mandible. So they're going to form a triangle right here at the gonial angle of the mandible. So you're going to pinch off little balls of clay and you're going to place them into a triangle. So here I am showing you just tiny little balls of clay that you pinch off from the coil. So you're going to collect lots and lots and lots of these tiny little balls of clay that you're going to pinch off from those coils of clay that you've rolled out. Keep pinching until you have a whole bunch of little balls of clay. Now you're going to place each small ball of clay onto the masseter muscle. And when you put them on the masseter muscle, place them on the masseter muscle and then give them a little bit of a twist to make them stick to the clay. And then you're going to press down on the ball of clay just slightly. So it's still a ball of clay, but it's not quite rounded on the surface. And you're going to continue doing this, taking little balls of clay and twisting them onto the masseter muscle. And then after you've twisted them, you're going to press down with your finger just to slightly flatten them, just slightly. And you're going to form this triangle for the parotid gland. So continue to add these small balls of clay to the masseter muscle until the parotid gland is complete. So now, using these instructions, you can go ahead and attach the parotid gland on the left side of the skull. There it is. The facial anatomy project is complete. Doesn't it look super cool? So now you need to find a place to display your amazing creation so everyone can see all the hard work and effort that you put into it. I hope you learned a lot from this project and thoroughly enjoyed the process of creating your own facial anatomy model. Have a fabulous week. Bye now.